So that's good. So again, go ahead and just let that bend now and just see what you feel on your own. So we should have actually tested before just to show you, but I just wanted to show you quickly how we can release a scar. Now, the neat thing about that is the eyes are a direct bud embryologically of a neurologic formation of the brain. So the brain buds are actually coming forward, and these are eyes. They perceive everything. Those patterns that we just did with the eyes are actually specific neurologic patterns associated with a perception of fall. Remember last week we had talked about my brain's perception of center of gravity? If I have a posterior sense of fall, my eyes will be looking downward. If I have a strong anterior sense of fall, my eyes will be looking upward. So in essence, this scar created for her, the lower scar, a very strong anterior fall that we'd actually needed, an inferior fall that was corrected by strengthening her eyes in a superior gaze, okay, versus then the other pattern where we actually had her look downward. Sometimes it will be right or left, sometimes it will be in the diagonal, the eye patterns.
So just out of curiosity, since I had one down, one up, was I trying to balance between the two?
Yes, that's exactly right. So this is my
because
sway.
one was doing forward and one was doing back. So.
Yes, yes, good observation. So again, massage therapist, she's a little bit ahead of me on that, but that's exactly right. Okay, she's thinking ahead on that, and that's exactly what we want to do. So now she can take that information back, and when she's working with someone like me who's had this surgery on my arm from my mountain bike wreck when I was back in college, and I had a plate and 6 screws in there, I didn't have this knowledge back then, and so when I'd move this skin, it didn't move like the rest of my skin. It had become very blocked. So even when water would run on my hand, that radial nerve that comes right across that, it would shock all the way up my whole arm just because that nerve was still entrapped. So when they went in and took out the plate and screws, the orthopedist that did the follow-up surgery actually dissected the nerve for me to release that entrapment. But then again, I was still so young in my learning that I didn't know to release that scar, so it still had a lot of that tingling. It's taken me the last 3 years to learn more to be able to not have that sensation anymore when I get just water or fine touch on that to make it shock up my arm anymore. Okay? So again, another key to healing from trauma. Right? Thank you.
So old scars, very old scars, can still be...
Absolutely. Are essential. Essentially, we need to continue to heal those because they can actually create what we call interference fields in the body. Okay? We won't go through that tonight, but we can go through the energy flow of the body, if you will, another time. Okay? So scars are really, really key, and scars actually leave for us a signature or a telltale sign of what's happened here. It's a history or a log of the body. Okay? Around this area we have a lot of aspen trees. You go up and back in 1965 where you look at Miss Carrie Miner putting her signature up there in that tree. It's still there from 1965. It's the history of the tree. All right? Same thing in our bodies. It's the history of our body. And we can unwind some of the trauma associated with that history just by doing some of those scar releases. All right? So pretty fascinating, I think.
We have a saying that said fools' names and fools' faces always appear in public places.
So you knew better.
So even something like infertility could come from a large scar in the abdomen or something.
Okay, so the next question here is, that was just raised, could infertility be potentially related to scarring in the abdomen? And the answer is absolutely. One of the most common causes of infertility scarring in the abdomen of the female is actually a condition known as endometriosis, which is the endometrial tissue has actually gone back up the fallopian tubes and now is inserted somewhere in the pelvis, either on the bladder or on the intestines. And that each month then, in essence, creates a scar response. That can create an immense amount of trauma. And the laparoscopic procedures where they go through the navel to clean up all of that scarring may help or may give a female a window of time to be able to get pregnant again if they can alleviate the endometriosis significantly enough to keep it healed. Okay? There are several other things that we do to help treat endometriosis, but I'm saying in the surgical world and from the OBGYN procedures, that's commonly, yes, a scarring procedure that can actually create then infertility. Okay?